Up to 18 million Americans suffer from sleep apnea. Many of them don't know it. Now, a long-term study from the Mayo Clinic highlights the danger of this disorder.
The study shows that people with sleep apnea have a higher risk of dying from sudden cardiac arrest. Dr. Carol Ash is director of sleep medicine at Meridian Health, and she joins us at the table this morning. Start us off with who's most affected by it and what happens when you have it.
Well, surprisingly, Gail, many people do have this. Children can have it, and 16% of people who have sleep apnea aren't even obese. We think of obese people as having it.
That's what I thought.
Yeah. What happens when you go to sleep at night? The muscles in the throat relax, and what that does is that causes your airway to narrow. That's normal, but in some people, that narrowness goes beyond and collapses down. That's an apnea. If you stop breathing for 10 seconds, 5 times an hour, we say you have sleep apnea.
And it sounds like what?
Well, think of it as if you're being choked. So if you hear someone snoring, you hear, and then you hear, and then suddenly they'd stop. The noise would be silent. That's an apnea. When you're observing someone not breathing, you're saying, oh, thank God.
So what happens after you go through 10 seconds of not breathing?
Well, your brain finally realizes you're in a state of a respiratory emergency, and it reacts. It releases adrenaline. That pumps up the blood pressure, the heart rate. Inflammatory substances are released. That injures blood vessels, and over time, you're at risk for sudden cardiac arrest.
Right, and this study shows it can increase risk for sudden cardiac arrest.